second equality incentive program for behavioral health provider organizations. Attendees will be on mute during the broadcast. If you have questions, please type them in or feel free to submit them afterward. This broadcast is being recorded and will be available on the MIHI website. In today's webinar, we will present a review of legal considerations when responding to the solicitation, a brief overview of the Mass Technology Collaborative and MIHI, the Mass eHealth Institute, followed by a more detailed overview of the eHealth Equality Incentive Program, or eQIP. We will then review the individual components and requirements of the solicitation, including eligibility criteria, milestones, timelines, and application process. Please note that some solicitation components have been edited for brevity in this webinar. Please refer to the solicitation for precise requirements. I'm your host today, Judith Iwanski, the manager of MIHI's eHealth Equality Program. Also with me today is Olivia Joplin, the eHealth Programs Coordinator for MIHI. We expect there will be time at the end to answer questions that were submitted during the presentation. As I said, additional questions may also be submitted in writing to proposals@masstech.org. All questions and answers will be posted on the MIHI, MassTech, and ComBuy's websites. First, I'll give a brief discussion of legal considerations when responding to this solicitation. This solicitation has been posted to the MIHI and MassTech websites and to ComBuy's, the Commonwealth Procurement Portal. To the extent that anything stated or presented in this webinar is inconsistent with the RFP, the solicitation written documents shall govern. MassTech reserves all rights to amend, modify, or otherwise clarify the solicitation and any written answers to questions presented. It is the respondent's responsibility to check the MIHI, MassTech, or ComBuy's websites for updates, addendum, and modifications to the solicitation. In addition, we ask that you carefully review the solicitation requirements and specifications. Non-responsive applications may be rejected. I'm not going to spend a lot of time on the MassTech overview. We ask that you please refer to our website for additional information. In brief, the Mass Technology Collaborative is a public economic development agency established pursuant to Mass General Laws, Chapter 40J. It is an independent authority of the Commonwealth of Massachusetts. The Massachusetts eHealth Institute, or MIHI, is a non-divisible component of MassTech and functions as one of its business divisions. Other divisions under the MassTech umbrella are the Innovation Institute and the Massachusetts Broadband Institute. MIHI is dedicated to the advancement of healthcare through the use of technology. It is the designated state agency for coordinating healthcare innovation, technology, and competitiveness, accelerating the adoption of health information technologies, promoting health IT to improve the safety, quality, and efficiency of healthcare in Massachusetts, and advancing the dissemination of interoperable electronic health record systems in all healthcare provider settings that are networked through a statewide health information exchange, the Mass Highway. This slide shows the high-level vision, mission, and goals of MIHI, including supporting the triple aim of health reform, better population health, improved patient care, and lower cost of health care. MIHI's focus is to drive the adoption of health IT among all healthcare providers in Massachusetts in order to positively impact healthcare and achieve the triple aim. MIHI provides eHealth assistance through programs, services, collaboration, education, and funding. At a high level, MIHI currently has 4 major initiatives: the eHealth Equality Program, the Connected Communities Program, eHealth Services and Support, and eHealth Cluster Development. This eQIP solicitation is administered as a part of the eHealth Equality Program. The objective of the eHealth eQuality program is to promote effective use of interoperable EHRs by eligible behavioral health provider organizations in an effort to improve the quality and efficiency of healthcare in the Commonwealth while containing costs. Note that for this incentive program, it is eligible organizations, not eligible providers, as under meaningful use, and eQIP payments will be made to organizational applicants. As noted previously, one of MIHI's goals is to advance dissemination of EHRs in all healthcare provider settings and facilitate their secure networking through the Mass Highway. Current data, including a recent MIHI provider survey, has shown that many independent behavioral health organizations, those unaffiliated with large providers or healthcare systems, are lagging behind other sectors in the adoption of EHRs. Chapter 224 of the Acts of 2012, the second major piece of health reform legislation passed in Massachusetts, directed MIHI to prioritize assistance to organizations that are, 1, generally not eligible for the Medicare and Medicaid EHR incentive program, and 2, lack access to other resources to implement EHRs. The legislation specifically referenced mental health facilities and community-based behavioral health, substance use disorder, and mental health care providers. For the purposes of this solicitation, behavioral health services are defined as direct patient care services by behavioral health providers used to evaluate and treat people with mental health and/or substance abuse disorders. Substance abuse treatment services must be provided through programs that are licensed or approved by the Mass Department of Public Health. Behavioral health providers must provide direct patient care and either be licensed clinicians or clinical staff authorized to provide direct patient care under the supervision of a licensed behavioral health provider. For the purposes of this solicitation, entities are deemed affiliated if their financial statements are part of the same consolidated financial statements, one controls the other, directly or indirectly, or they are under common control. Total organizational revenue is the aggregate amount of revenue from all sources of income within Massachusetts and out of state for all facilities and operations within the same corporate structure of the applicant entity. Patient services revenue, as used in the eligibility criteria, is the total of net patient service revenue from third-party payers, that is gross PSR less any contractual adjustments, plus any payments under a state or local contract to provide behavioral health services to public payer clients. MIHI reserves the right to further define the terms used in this solicitation. As I said, this is MIHI's second eQuip solicitation for behavioral health organizations. The major changes from Round 1 to Round 2 are, Round 2 is open to both not-for-profit and for-profit organizations. And 2, the minimum threshold for participation in the solicitation has been lowered from $1 million to $1.5 million annually total organizational revenue. In addition, we've addressed some feedback we received during the earlier round by making program modifications. These are applicable to both Round 1 grantees and new grantees under this solicitation. First, program duration. The end date was changed from December 31st, 2016 to June 30th, 2017. This is an additional 6 months to meet program milestones. Second, we have moved EHR installation and achievement of MRAM Stage 3 from Milestone 1 to Milestone 2. Grantees will now receive Milestone 1 payment upon submission of a MIHI-approved transformation plan and highway use case. Certified EHR technology was required for subsequent stages. Third, the payments have been adjusted. We'll now pay 25% of the total payment for each milestone. You may recall Milestone 1 was formerly 15% of the total payment. We are now giving a larger amount up front. Finally, milestone 4, the highway milestone, has been amended. We will now also accept transacting on another health information exchange to meet this milestone, as long as that health information exchange, or HIE, is connected to the Mass Highway. Any organization receiving a grant under the incentive program is required to do the following. Use certified EHR technology, or CERT, to meet the functions specified in each milestone. CERT does not guarantee interoperability. However, certification does help ensure the EHR will provide standard-based functionality that will support interoperability. MIHI uses the ONC's Chapel website, listed on your screen, to verify CERT status. If a vendor's product does not appear with a certification number on the Chapel list, it is not ONC certified for the purposes of this program. However, MIHI is open to requests for exemption from certification in a limited instance. For example, when no viable certified product exists for a particular function. Next, grantees must submit a questionnaire to the Healthcare Information and Management Systems Society, or HIMSS, Analytics Ambulatory EMR Adoption Model, AMRAM, to determine their EHR adoption baseline. They must develop an approved transformation plan and use case, must commit to achieving all 4 eQIP milestones, and must submit midterm and final reports and attend a grantee in-person event once annually. To be eligible for participation in the incentive program, organizations must meet all of the program's eligibility criteria. In the next few slides, we will review the details of each of the eligibility criteria. We will also review the documentation required to substantiate that an organization meets the criteria. First, an organization must provide direct patient behavioral health clinical care services in Massachusetts. Examples of non-clinical services are those services that enable individuals to access health care. For example, case management, referrals, translation, transportation, health literacy, and outreach. To substantiate this criteria, an organization must submit documentation indicating it received patient service revenue for behavioral health clinical services for any 1 month. See solicitation attachment A1A. Second, an organization must hold a currently valid license to provide behavioral health clinical care programs and services in Massachusetts. Or, if the organization is not required to be licensed, its clinical providers must have valid professional licenses required to provide behavioral health programs and services in Massachusetts. A copy of the current license must be submitted with the application. Upon request, an organization must submit a list of providers licensed to provide behavioral health clinical services in Massachusetts, including name, specialty, license type, and expiration date. Third, the organization must provide primarily behavioral health care services in Massachusetts. That is, more than 50% of the annual total organizational revenue must be patient service revenue from the provision of behavioral health services in the Commonwealth. Documentation indicating that percent for the most recent state fiscal year is required, and these revenue figures must be documented in the chart in attachment A1B. Importantly, the figures must be accompanied by appropriate audited supporting documentation. This could be a Uniform Financial Statements and Independent Auditor's Report, or UFR, or other audited report. Fourth, the organization may not be affiliated with an acute care hospital system. Please note the definition of affiliated that we reviewed earlier. An exception, organizations that are part of such a hospital system are eligible if the annual organizational revenue of the parent is less than $25 million. Fifth, Organizations must serve a large proportion of public payer clients. That is, greater than 50% of the PSR from mass facilities must be public payer. Chapter 224 requires an emphasis on organizations that serve a high proportion of public payer clients. The intent is to support those behavioral health provider organizations that provide healthcare services to some of the Commonwealth's most vulnerable individuals, they who receive multiple and costly services across the care continuum. It is particularly important that these organizations are capable of electronic communication with other healthcare providers that may be treating these individuals. To substantiate this requirement, an organization must submit documentation indicating the source and amount for all behavioral health PSR from Massachusetts. That's private payer, Medicaid, Medicare, etc., for the most recent state fiscal year. These revenue figures must be documented in the chart, attachment A1B, and the calculations must be accompanied by audited supporting documentation, such as a UFR. The final eligibility criteria is that an organization may not be an eligible hospital or have eligible providers, as those terms are defined by the federal Medicare and Medicaid EHR incentive programs. There is one exception. An organization with some eligible providers may be eligible for the eQIP program if less than 30% of the organization's clinical care providers are eligible providers and the organization is not affiliated, or the annual total organizational revenue of its parent is less than $25 million. Substantiation requires a statement documenting that the organization is not an eligible hospital under the HITECH Act and that its providers are not eligible professionals under the definition of the Act, or verification that less than 30% of its clinical care providers are eligible professionals and the organization is not affiliated, or the annual total organizational revenue of its parent is less than $25 million. MIHI will consider other factors in considering the application submitted, including how the organization intends to use health information technology in light of Massachusetts healthcare policy objectives. MIHI may contract with those applicants that meet the eligibility criteria, clearly describe approach feasibility, organizational ability and capacity, and anticipated impact, and sufficiently demonstrate organizational need and commitment to implementing an interoperable EHR and transacting on the highway. We will review these factors in greater detail a little later. In addition, MIHI is collaborating with the Executive Office of Health and Human Services to provide optional additional funding to eQIP grantees that will maximize EHR interoperability capabilities. The State Innovation Model, or SIM, Mass Highway Grant is a companion grant to eQIP. Additional funding is to optimize grantee highway use cases and maximize their EHR interoperability to achieve interoperability across the continuum of care. eQIP Milestone 4 requires connection and use of an HIE or Mass Highway to exercise its use case in production with at least one trading partner with which it is not affiliated or joined together contractually or through a shared entity, and development of an approach to operationalizing opt-in patient consent for the Mass Highway. The additional SIM funding will assist grantees to achieve greater volume of transactions on the highway and increasingly sophisticated use of the highway. This companion grant is closely aligned to eQIP, but it is a separate funding program and will require a second, be a brief application through EOHHS. This slide provides an overview of the eQIP milestone requirements. We'll go into additional detail in the next slide, but in general, the requirements for each milestone are as follows. Milestone 1 requires a transformation plan and development of a highway use case that has been reviewed and approved by MIHI. Milestone 2, this is the first milestone to require an EHR. It requires achievement of AMRAM Stage 3 and a description of the organization's certified EHR technology. Milestone 3 requires achievement of AMRAM Stage 5 and an updated description of the certified EHR technology. Milestone 4 is integration of the highway, or the HIE connected to the highway, to the EHR. It requires a copy of the HIE or Mass Highway Participation Agreement, attestation from a grantee and trading partner that the production transactions are being sent or received for the use case described in the Highway Use Case Form developed in Milestone 1, and a description of the organization's approach to operationalize opt-in patient consent for the HIE or highway. Grantees are paid 25% of the total incentive for each milestone achieved. Milestones 1, 2, and 3 must be met in sequence. Organizations can meet the highway milestone anytime after meeting highway milestone 1. For eQIP, MIHI has aligned milestones 2 and milestone 3 to the HIMSS Ambulatory EMR Adoption Model, or AMRAM. This adoption evaluation model focuses on key IT systems that need to be implemented for achieving higher levels of access, quality, efficiency, and safety. The chart on your screen provides an overview, giving examples of the requirements to meet each stage. The full AMRAM model has 7 stages. However, eQIP grantees will meet program milestone 3 upon reaching AMRAM stage 5. Grantees are required to complete a HIMSS online questionnaire within 30 days of contracting with MIHI to achieve an MRAM score. This score will determine an organization's baseline for milestone payments. In addition, grantees are required to incorporate that score and the gap assessment findings provided by HIMSS into the transformation plan that is required in milestone 1. Milestone 1 requires the development of a transformation plan approved by MIHI that describes how the organization will prepare and transform its practice to maximize the potential of its investments in health IT in order to achieve identified outcomes. The plan must include anticipated outcomes, including the operational and/or clinical outcomes being targeted, and how the grantee will use implemented health IT to better integrate behavioral with physical health care. Current state analysis, which is the current health IT state of the organization's practice. Future state analysis, the desired future health IT state of the organization's practice at the end of the period of performance. Gap analysis, the gap that exists between the current and future state and how the organization intends to close that gap. And grant approach, including the approach to meeting each of the program milestones, how the organization will protect its electronic health information, and the timeline of major activities to meet outcome goals and program milestones. As noted, grantees must also complete the AMRAM survey, and they must complete an approved highway use case development form. Examples of the forms are on the MIHI website, mihi.masstech.org. Milestone 2 requires the organization to demonstrate that it meets the criteria for AMRAM Stage 3. It includes using electronic messaging, computers having replaced paper charts, clinical documentation, and clinical decision support. They must also provide a description of their certified EHR technology, including the vendor, product, care setting, and the extent of use. For Milestone 3, grantees must achieve AMRAAM Stage 5, which includes personal health records, an online patient portal, computerized provider order entry, or CPOE, use of structured data for accessibility and EMR, and internal and external sharing of data. Grantees must also provide an updated description of their cert, including care settings and the further extent of use. For Milestone 4, grantees must connect to and use the Mass Highway, or an HIE connected to the highway, to exercise their use case in production with at least one trading partner with which it is not affiliated or joined together contractually or through a shared entity. Please note that this is a broader standard than affiliated for the purpose of eQIP eligibility. For the purposes of this grant, webmail is not sufficient for transacting via the highway. MIHI is intended to advance interoperability, thus using an EHR direct connection or a gateway device, such as a LAN device, is required. Grantees must also provide the organization's approach to operationalizing opt-in patient consent requirements for the highway or an HIE connected to the highway. Again, Milestone 1 requires development of a transformation plan that is approved by MIHI to describe how the organization will prepare and transform its practice to maximize the potential of its investments in health IT in order to achieve identified outcomes. Grantees must also complete the use case development form. This slide reiterates some of the requirements of the transformation plan for Milestone 1. Once a grantee is accepted, the transformation plan must be submitted within 90 days of execution of a grant agreement between the organization and MIHI. An organization's transformation plan is expected to be very comprehensive, demonstrating a thorough analysis and extensive level of detail. MIHI may request clarifications, modifications, and/or revisions to a transformation plan prior to any approval. This slide illustrates the payment structure. Grantees receive 25% of the total payment for each milestone. Incentive payments progress for reaching advanced health IT integration and will be awarded through achievement of 4 milestones over an approximately 2-year period. Individual incentive payments are tiered by organizational size, and they range from between $8,250 to $20,625 per milestone, but they will not exceed a total of $82,500 to any one organization for all 4 milestones. Please note that practices with annual revenue of less than $500,000, $500,000, sorry, are not eligible for this program. I'll now present a brief overview of the eQIP solicitation application process and evaluation criteria. This timeline repeats the important dates related to the RFP. A second webinar will be held on April 30th. A third webinar may be added if necessary. We anticipate a final award in July of 2015. The next 2 slides outline the RFP application submission process. Please be sure to follow the process exactly as it is laid out in the RFP. Late or incomplete applications will not be accepted. All applications are due no later than 3 p.m. on Thursday, May 21st, 2015. MIHI has developed a checklist that's posted on the MIHI website with a list of FAQs. Applicants can use these as guidance when completing their application packets for submission. We very much encourage prospective applicants to email any questions to us at proposals@masstech.org. Questions and answers will be posted on a frequently updated FAQ section of the eQIP solicitation page on the MIHI website. After the filing deadline, MIHI may or may not seek additional information from an applicant prior to making selections. MIHI will issue a notice of grant award for each application selected for funding that will stipulate the period of performance, the targeted milestones, the terms and conditions of the award, and reporting requirements. A notice of intent to submit application should be submitted. Submission of this non-binding NOI does not bind a prospective grantee to submit an application. However, such an NOI is very helpful to MIHI when it is reviewing grant applications. As stated in the solicitation, numerous documents must be submitted at the same time as the application. These include the proposal narrative. There's an 8-page limit to this, and we will go into more detail on the next slide. The eligibility substantiation form includes the organizational behavioral health profile form and a patient service revenue chart with supporting documentation. These are noted in attachments A1A and A1B. An EHR current product table, as applicable, in attachment B. An officer certification form, see attachment A2. A signed organizational approval letter stating support for the proposed project. An application summary sheet form, attachment D, and an authorized application signature and acceptance form, which is attachment E. The proposal narrative is a critical part of the application. Each of the items must be addressed. Note that each section does have a size limit, and the total narrative should not exceed 8 pages. It is especially critical that the abstract capture the significant details of your organization's approach to meeting the program objectives. This abstract will be used to orient reviewers to each applicant's proposal and will certainly facilitate contract scope writing. The statement of need should describe why the organization needs the funds that are available through this grant program. The project approach should provide a synopsis of the organization's proposed approach to adopt and use health information technology currently in use and/or that needs to be procured in order to meet each proposed milestone. Applicants must estimate the total cost of the project and the timeline to reach each milestone. EHR product. Complete the EHR current product table, if applicable. This includes vendor, product, version, chapel number, status, care setting, and extent used. The Mass Highway status. If you are currently using the Mass Highway or an HIE connected to the Mass Highway, describe how you're connected, whether that be land, webmail, EHR direct, or how using. If you're not using an HIE to Mass Highway, describe how you intend to use it. Health system integration. The applicant should describe how the organization will support efforts to integrate behavioral health services with other care settings. For example, settings the patient is referred to or from. Examples might include coordinated treatment plans or maintaining continuity of care. In-kind resources. Describe those resources the organization intends to provide to supplement or support these incentive payments and their estimated value. An applicant is required to designate a project manager for the entire project and describe how senior leadership oversee the initiative. Value of investment. Describe how the receipt of the incentive payment will help achieve long-term benefits to the Commonwealth and meet the state's healthcare policy goals. Examples might include leveraging health information technology and interoperable EHR systems to improve patient health, coordinate care across service providers, for transitions of care, or a reduction in healthcare costs. Anticipated challenges. Describe those anticipated challenges and problems that the organization envisions may occur in meeting these milestones and ways that it will be able to address them. Critical attachments to the application include eligibility criteria substantiation form, that's attachment A1, the organizational behavioral health profile, attachment A1A. This chart should be completed only for those facilities providing clinical behavioral health care services in Massachusetts. The organizational and revenue verification form, attachment A1B, should include source and page number or location to support the PSR amounts and the percentages within the attached supporting documentation, such as the Uniform Financial Statements and Independent Auditor's Report, UFR, or a similar audited report for the most recent fiscal year available. Include a brief explanation of the organizational behavioral health services, which should be broken out in the supporting documentation or explained in a table. The Officer's Certification Form and Signature Page, attachment A2, and the EHR Current Product Table, attachment B. Again, please see the application checklist that is available on the MIHI website for reference. MIHI will review each application against the following criteria. Compliance. Has the applicant met each of the eligibility criteria, including attestation and substantiation requirements? Need. Has the applicant described why they need the funding and how other sources of funds or resources are insufficient to meet their goals? Feasibility. Has the applicant described a feasible approach for meeting eQIP milestones and achieving a more advanced state of integration and use of health IT? Ability. Has the applicant demonstrated the ability to meet the guidelines and conditions as laid out in the solicitation? Capacity. Has the applicant sufficiently indicated organizational capacity to carry out their proposed approach to achieving the milestones? Commitment. Has the applicant demonstrated their commitment to meeting the intent of the grant and all 4 milestones? And impact. Has the applicant addressed how it intends to use its EHR and other health information technology to support the Commonwealth's health care policy objectives? Please visit the MIHI website. That's mihi.masstech.org. You can visit the education page for upcoming events, presentations, toolkits, and other resources. This includes a new EHR planning and procurement toolkit with recommended action steps for providers to begin the planning and procurement process for adoption of EHRs. Included are collateral materials, such as checklists, templates, and spreadsheets that you can use and adapt to help collect information and plan your EHR procurement. We will now take questions submitted during the webinar. Note that questions may also be submitted by email and will be posted on the website. Olivia? Since no questions have been submitted, we will give just another minute. Again, I encourage you to please submit your questions in writing. Any questions are fine. Check the frequently asked questions site on the website, which we update. Whenever we get a question, we post both the question and the answer on the website. And hopefully the checklist that's there for your guidance will help you lay out the materials that are needed. Great. Thank you for your attendance.